So let's start the quiz competition. There are some rules. There are total 8 rounds. There is one buzzer round. If two teams score the same marks after the final round, there will be a tiebreaker. And Quizmaster's decision is final. And best of luck to all of you. May the best team win. Our first round is the archive round. So the questions are based on the history of ophthalmology. There'll be a question, and if you answer in the first go, you'll get 20 marks. If you can't answer, we'll give you a clue. So if you answer with the first clue, you'll get 15 marks. And if you answer with the second clue, you'll get 10 marks. And you'll get 15 seconds for each clue. There is no negative marking. And if the team does not answer, the question is passed to the next team. And the next team will get 5 marks. I hope it's clear. Okay, shall we start? First question to team 1 or team A. Identify the condition. I'll give you the first clue. The occurrence of glaucoma in association of this condition was reported by Maynard in 1909.
Juvenile idiopathic arthritis.
No. Shall I give the third clue? It is caused by contamination of cooking oil with Argemona mexicana.
Epidemic dropsy.
Correct. So team A gets 10 points. So the answer is epidemic dropsy. It's a disease caused by unintentional ingestion of Argemona mexicana. It is used as an adulterant of wheat flour or cooking oil such as mustard oil. So team B, are you ready? Identify the Swedish ophthalmologist.
Cocker.
I'll give the next clue. First clue. He received Nobel Prize in Physiology of Medicine in 1911.
Gallstrand.
Correct answer. Team B gets 15 points. He invented slit lamp along with Carl Zeiss. So that is Alvar Gallstrand. He applied the methods of physical mathematics to the study of optical images and of the refraction of light, and for this he received Nobel Prize in 1911. Team C. Identify the plant. Okay, I'll give the first clue. The plant is found native to several states in northern Brazil. Okay, I'll go to the third clue. A glaucoma medicine was isolated from this plant by Hardy and Gerard in 1874. Team D.
Cocaine.
Pardon?
Pilocarpine.
I want the plant's name. Team E.
Belladon.
No. Team A. Team B. Okay, the answer is Pilocarpus microphyllus. The pilocarpine is entirely derived from the leaves of the shrub. The next direct question is to team D. Identify the German ophthalmologist. Okay, first clue. He introduced iridectomy as a method of treating glaucoma. And the second clue, he is also credited with design of a specialized knife used in cataract surgery. Team E. Team A.
Abraham Abraham.
What? Okay. Team B?
Onography.
Correct. Team B gets 5 marks. That is Albrecht von Graffe. He's also described combination of retinitis pigmentosa and perceptive deafness in Usher syndrome, and von Graffe knife is used in cataract surgery. So 5 marks to team B and direct question to team E. Identify the instrument. First clue. This was initially called as Augenspiegel, that is eye mirror.
Direct ophthalmoscope.
Can you modify it? It was invented by Hermann von Helmholtz. Now you can try. You can try with the third clue. The time's up. Okay.
Helmholtz direct ophthalmoscope.
Correct. So I think I can give 5 marks to them. I'll give 5 marks to team E and 5 marks to team A. That is Helmholtz ophthalmoscope. Even Johannes Perkinge and Charles Babbage had fashioned an ophthalmoscope, but they did not publicize it. Okay, the next round, second round, is Catch Me If You Can. These are picture-based glaucoma questions. This is a buzzer round. 15 seconds per question. You can press the buzzer only after I finish the question, because you can very well read the question, but you should give me time to tell the question. 10 marks for every correct answer and -5 for wrong answer. Shall we go to the first question? Identify the condition. Team E.
Blood staining of cornea.
Correct answer. 10 marks to team E. Second, what is Senmeyer's line? Team B?
Pigmented line in the posterior lens capsule.
No.
Seen in the pigmentary glaucoma.
Can you say it again?
The pigments seen in the sonules. Sonules of the lens seen in pigmentary glaucoma. Senmeyer's.
Okay, I can give that. These are ring of pigments on the peripheral surface of the sonular insertion. So 10 marks to team B. Next question. Which syndrome includes this condition with cerebellar ataxia and mental retardation? Team E? No, -5. It is Gillespie syndrome. No, there is no, just one chance, okay? This is Gillespie syndrome. Aniridia with cerebellar ataxia and mental retardation. Okay, the fourth question. Identify the instrument and mention its use. Time up. Audience? Somebody? No, postgraduates. Okay, this is Hoskins lens used for laser suture analysis. Now the fifth. Why is the management of this condition an emergency? Okay, what is this? Any idea? Picture is clear, no?
Extruded glaucoma drainage device.
Yeah, this is tube exposure and that can cause endophthalmitis. So, while the scorers tabulate the scores, so we have 2 rounds are over. So, while they tabulate the scores, I have an audience question. Identify the famous musician and what is the cause of his blindness? Anyone can answer. Arun sir. Arun sir. Yes. And the disease? No. No. ROP. So this is Stevie Wonder, the famous American musician, and he was born 6 weeks premature, and he had ROP, and he had a retinal detachment, and he's blind. Oh. Ma'am scores.
Okay, so at the end of 2 rounds, the highest scorers are Group B with 30 points, Team B. And Team A is with 15. Team E, the 5th team, is with 10 marks. And C and D are yet to start their accounts. Yep.
Okay, thank you, ma'am. So now we go to the 3rd round. That is Spotify round. Okay. So this is a spotters round. 3 spotters per team. 15 seconds for each question. 10 marks for correct answer and -5 for wrong answer. Shall we go from E to A this time? Okay. First question to team E. Name the multisystem genetic disorder where you can see this clinical finding along with optic disc drusen. Okay, it is Aladil syndrome. Identify the instrument. 0 marks. Okay, this is Pascal's dynamic contour tonometry. 3rd, identify this condition.
Emulsified silicone oil.
Causing?
Silicone oil induced glaucoma.
No. Inverse hypopyon. We'll give you 10 marks. Okay. Now next question to team D. Identify the instrument. This is Kelly sponge. Second, what is the mutation in this condition? Mike? No, the mutation. FOXL2 mutation. Okay, blepharophimosis. Identify this clinical condition. This is ocular cysticercosis. Okay. Team C. What is the mode of inheritance in this condition? Look at the picture carefully.
X-linked. X-linked.
No. This is ectopia lentis et pupillae, autosomal recessive. -5. Which topical drug can reverse this condition? This is vortex keratopathy, can be reversed with heparin. Secondary glaucoma, which can be diagnosed with UBM but not with ASOCT.
Malignant glaucoma.
Correct. 10 marks. Next to team B. Sorry if I'm going fast. What is the significance?
corkscrew vessels seen in carotidocavernous fistula.
No. -5. This is sentinel sign. Dilated episcleral vessels in the same quadrant as ciliary body melanoma. What is the drawback of this instrument?
Central part of the cornea only is imaged, central 3 mm.
Correct, correct. Only central 3 mm is measured, plus 10, and identify the clinical sign. Try. Have try. Okay, team A. Most common systemic association of this condition? Abnormal thyroid function, hyperthyroidism, SLK. Most common cause of vision loss in this condition? This is angioid streaks. It can the CNVM, cause of loss of vision is CNVM. What is its normal opening pressure? Which valve was this?
Ahmed glaucoma valve.
8 mm mercury. Okay. So we go to the next round. This is the round has been named as fasten your seat belts. So this is a subspecialty round. So we are giving you a few subspecialties and you'll have to take lots. 3 questions per picture. First question carries 15 marks. If you don't know the answer, we'll give you the answer. And even if you say it wrong, we'll give you the answer. Second question carries 10 marks and third question carries 5 marks. There is no negative marking, no passing of questions, and 15 seconds per question. Okay? So which team has got retina? Team B. Identify the condition.
Retinoschisis. X-linked juvenile retinoschisis.
Correct. 15 marks. Second question. Which is the gene mutated in this condition?
Retinoschisin gene. In
RS1 gene.
Its name is retinoschisin, madam.
Okay, I'll give that 10. What is the typical appearance of macula in this condition?
Cartwheel appearance.
Cartwheel or spoke wheel appearance. So they get 15 plus 10, 25 plus 5, 30 marks. Uvia? Team E. Okay. 50-year-old male with redness in both eyes since 1 month. On examination, there is granulomatous capies, iris nodules. Fundus examination showed snowball opacities, retinal vasculitis with candlewax stripping. So this is sarcoid uveitis. What is Hereford syndrome? That is a question. There is no negative marking. Okay. It's uveitis, parotitis and fever with or without facial palsy. Second, as per IWS criteria, mention the lab diagnosis required for definite sarcoidosis. Okay. What granuloma?
Non-caseating granuloma.
Correct. 10 marks. And third question, most common neurophthalmic manifestation of sarcoidosis.
Optic neuritis.
It is facial and optic nerve cranial neuropathy. No. So you get 10 marks. Who got strabismus? Okay, team D. Identify this condition.
Do answer retraction.
Correct. Duane retraction syndrome. What is pumpkin seed sign?
The PFH height decreases on
I didn't get you. Okay, there is severe upshoot when cornea disappears in the lid. How to differentiate this condition from 6-nerve palsy?
the palpable fissure height decreases on abduction.
Correct. On?
Sorry, adduction.
Correct. Okay, 5 marks to team D. 20. Cornea? Okay. What is the diagnosis?
Corneal dystrophy,
Which corneal dystrophy?
stromal,
Snap dot fingerprint dystrophy. Time up. Okay. Which method of slit lamp examination is used to look for the key findings in this condition?
retroillumination,
Correct. Retroillumination and sclerotic scatter. I'll give you 10 marks. And which stromal dystrophy is autosomal recessive?
macula,
Correct. So 10 plus 5, 15. ഇല്ല ഫസ്റ്റ് പറഞ്ഞു 10 plus 15. And team C, it's more of a histopathology picture. Identify the condition.
Pleomorphic adenoma of lacrimal gland.
No, this is sebaceous gland carcinoma. Okay. Name a special stain that is used to distinguish sebaceous gland carcinoma.
Oil red or Sudan black.
Correct? So 10 marks. And most common site of sebaceous gland carcinoma?
Upper eyelid.
Correct. So 10 plus 5, 15 for team C. So we have come to the end of this round. I have an audience question. Identify the instrument. No, ma'am. Pardon? Yeah, it is Snellen's entropion clamp. Okay. Now we go to the. Okay, sorry. Dr. Sheena will now say the marks.
We'll have the score at the end of the 4 rounds are team B is leading with 65 points. Team A and team E are tied at 30 points. and team C and D are tied at 20 points each.
The audience, for the audience question, your prizes will come soon. We have a prize for you. Next is the Pictionary round. Here there are 2 rounds, so each team will get 2 questions each. A picture from daily life is shown and the participants have to correlate it with ophthalmology, and we'll have a question based on that. So each question, like identification and the question, so 10 marks each. There is no negative marking, no passing of questions, and 15 seconds per question. So I'll have an example. So if this is crocodile, you know how can crocodile shagreen in cornea. So team A, are you ready?
Sunset glow fundus.
In
VKH.
correct. So 10 marks. Second question for you. Sunset glow fundus is seen in which stage of VKH?
Acute uveitic phase.
No.
Convalescent phase.
No. Just one chance. It is convalescent phase. So 10 marks. Total 10 marks. Okay. Second question to team B. No. Correct. 10 marks. Why is white-eyed fracture an emergency? Correct. 10 marks. So total 20 marks for team B. Team C. This is 8-ball hyphema. What is the black color in 8-ball hyphema suggestive of? You can try, there is no negative marking. So.
Blood staining of cornea.
No. Okay, that is due to impaired aqueous circulation and decreased oxygen concentration. Next to team D. This is collar-stud appearance in choroidal melanoma. Which cell type of this condition has a poor prognosis? Okay. Epithelioid cells. Team E. Candy stripe sign in ghost cell glaucoma. What are Heinz bodies?
RBC nodules in the pigmented which are clumped in the RBC.
These are RBCs with denatured hemoglobin. Now we have this one more round of this. We'll start with team E.
Coca-Cola bottle.
Coca-Cola bottle?
Thyroid orbitopathy.
Correct. Because it is tendon sparing, it has got the shape of a Coca-Cola bottle. What is Jelinek sign?
wrinkling of the forehead is written.
No. It is abnormal pigmentation of the upper lid. Team D.
Corkscrew sign. Cork sign and
The champagne cork appearance in chronic papilledema. What is Kestenbaum capillary number?
number of arteries less than the vessels on the disc if it's less than 6 pallor optic disc pallor.
Okay, what is okay, I'll
optic
give you the
atrophy.
answer. This is number of capillaries on the optic disc. So 10 marks. Team C. This is a bayonet sign in glaucoma. Bayonet is a rifle and a sword together. And what is Grant syndrome in glaucoma? These are inflammatory precipitates that are present in trabecular meshwork, a type of inflammatory glaucoma. Okay, to team B.
C-fan pattern seen in sickle cell retinopathy.
Correct. 10 marks. Which anti-glaucoma medication is contraindicated in sickle cell anemia?
Carbonic anhydrase inhibitors.
Correct. 20 marks. Team A.
Desert.
How can you relate desert to ophthalmology? Okay, this is sands of Sahara in diffuse lamellar keratitis. Why is stage 3 of DLK known as threshold DLK?
Residual corneal thickness.
Can be
Yes, but why?
because of the corneal granular appearance and more erosions, haze because.
Okay, I can partly give you the answer. It can cause permanent scarring. So, 5 marks for team A. Okay. Next is a multiple choice question round. One MCQ per team. There is no passing of questions. 10 marks for every correct answer. -5 and for wrong answer and 15 seconds per question. For team 1, which of the following statements about the side effects of acetazolamide is correct? It may increase the level of potassium in blood. It is safe to be used in patients with liver impairment, associated with an elevation of blood pressure and associated with Stevens-Johnson syndrome.
It is safe to be used in patients with liver impairment.
No, negative. -5. It is associated with Stevens-Johnson syndrome. It can cause liver impairment, so cannot be used in patients with liver disease. Team 2, which is true regarding retinal artery macroaneurysm? RAM may result in trilaminar retinal hemorrhages. Exudative RAM is usually associated with better visual prognosis than hemorrhagic RAM. Most commonly associated with hyperlipidemia, hemorrhagic RAM requires treatment compared to exudative RAM. Time up. Answer is 8. May result in trilaminar retinal hemorrhages. Team C. Which of the following features is associated with right-sided non-dominant parietal lobe infarction? Option dysgraphia, left-right disorientation, pie in the sky visual field defect, visual neglect. I'll give you 10 more seconds because I accidentally pressed the timer.
Pie in the sky visual field defect.
No, wrong. It is visual neglect. Right-sided non-dominant parietal lobe infarction causes left-sided visual neglect with pie on the floor. So -5 for team C. Team D. Which of the following corneal dystrophies has a different gene mutation than the others? Epithelial basement membrane dystrophy, granular dystrophy, Meesmann dystrophy, Thiel-Benke dystrophy.
Ma'am, option 3.
Correct.
Meesmann's.
Meesmann dystrophy, gene mutation at CK3 and CK12. Rest is big H3. Team E. Which of the following feature is most commonly seen in a child with X-linked ocular albinism? More common in females, positive angle kappa, normal binocular function, progressive reduction in visual acuity. It is positive angle kappa. It's more common in males. So while Madam tabulate the scores, I have an audience question. How can you relate this to ophthalmology? It's not steel, ma'am. Correct. Golden ring and successful hydrodelineation. So can we have the scores?
So at the end of 6 rounds, we have Team B leading with 105 points. Team A, D and E are all tied at 40. And Team C is 15 points.
Okay. Now we go to the next round, that is pick the odd one out round. So I have a trial for you. You have to pick an odd one out from this. This is a trial, no points. Yeah, it's Patan because other 3 has Kajol as the heroine. So same way, we'll have an odd one out in your question. And these are all syndromes. So you have to say which is the odd one out and you have to identify the syndrome. 15 seconds, 10 points for correct identification and 10 points for picking the odd one out. There is no negative marking. If the question is not answered, it will be passed to the next team and they'll get 5 points. So first question to team A. Team B.
Sarcoidosis.
No, which one are you ruling out? This is A, B, C, D. Which is the odd one out in this?
B.
Correct. So what is the syndrome?
Dry eye and fissured.
Syndrome.
Sjogren's.
Correct. So 5 plus 5, 10 marks. So Sjogren's syndrome, it is 9 times more common in females. Venus Williams is diagnosed with Sjogren's syndrome, characterized by keratoconjunctivitis sicca, dry mouth, tongue, enlargement of salivary glands, etc. So 10 points to team B and direct question to team B. Okay, time up.
Ruling out A
Correct.
for oculocutaneous syndromes named Warburg's albinism, Warburg syndrome, Waardenburg syndrome.
Correct.
Waardenburg
Waardenburg syndrome. So, since there is lack of time, okay, I go to team C. $20 marks. Sorry.
C.
Ruling out? C.
C.
Correct. It's 10 marks. And what is
Sarin syndrome.
correct? 10 marks. So total 20 marks for team C. Team D.
Ma'am, C. We want to.
C.
Yeah.
Wrong. Oh, sorry, I accidentally pressed. Anyways, team E, you get a chance. Can you identify the syndrome? Okay, team A.
Familial exudative vitreoretinopathy.
No. Team B.
Stickler syndrome.
Correct. 5 marks. Next to team E. Time up. Team A. Which one are you ruling out?
Weil-Marcesani syndrome.
No. Which one are you ruling out?
First picture.
Okay, that's not correct. One sec. Team B? Correct. But it is Weil-Marcesani syndrome, so I'll give 5 marks to team A and 5 marks to team B. Okay, so we have one more audience question. Identify, he is an ophthalmologist turned novelist. Correct. Next is a rapid fire round. So I'll again give chits. We are not going in the order. So whoever gets 1, 2, 3, 4, 5, we'll go that way. Okay? Scores before the rapid fire round, because that's the last round. Who's team 1, team 2, team 3, team 4, team 5? We'll start shortly. we'll have the scores before the final round.
The scores are Team B is leading with 145 points. Team A is at 45, they are second. Team D and E are tied at 40 and Team C is at 35.
Thank you, ma'am. So we go to the last round, that is the rapid fire round. Anything can happen, the scores can change. So we have 10 questions per team, maximum 60 seconds per team, 10 marks for correct answer, negative -5 for every wrong answer. Who's team 1? Are you ready? I cannot see you, okay? Or I'll just, okay, I'll turn. Start. Sorry. One sec. Sorry. Okay. This timer here is not working. So. Phone. Sorry. Okay. Let's start. The locus of all points in space of which images fall on corresponding points of retinas of the two eyes called?
Horopta.
Correct. How many layers are present at fovea?
4.
Wrong. Tram-track sign is seen in?
Sturge-Weber syndrome.
No. Site of lesion in Nathanael syndrome?
Pons.
No. Name the automated contact lens which can continuously measure IOP? Most common direction of lens subluxation seen in homocystinuria?
Infronis.
Correct. Total efferent pathway defect causes dash pupil.
Pass.
When is World Diabetic Day?
Pass.
Most common primary intraocular tumor in children?
Retinoblastoma.
Correct. So, these are the 10 questions. Oh, one more is a type of nystagmus seen in Creutzfeldt-Jakob disease. Sorry, you have time now? Okay, time up. So, we'll go for the answers. First answer is Horopta, correct. There are 6 layers in fovea. Tram-track sign is seen in optic nerve meningioma. Site of lesion in Nathanael syndrome is superior cerebellar peduncle. The automated contact lens which can continuously measure IOP is Sesame triggerfish. Most common direction is infronasal. Total efferent pathway defect causes amerotic pupil. World Diabetic Day November 14. And most common intraocular tumor is retinoblastoma. 1. Oh, sorry. The type of nystagmus in Creutzfeldt-Jakob disease is upbeat nystagmus. So 1, 2, 3 correct. 1, 3 wrong. 3 correct, 3 wrong, and 4 are unattended. Okay, so team E gets 15 marks. Who's team 2? Team 2 is team C. Starting. Okay, shall we start? Fabry's disease is caused by deficiency of?
Alpha galactosidase.
Correct. The clover leaf defect is the hallmark of?
Patient not false negative.
Correct. When is National White Cane Day?
Pass.
Corneal graft rejection line is also known as?
Podosity line.
Correct. Beneficial role of pan-retinal photocoagulation was first established in which study?
Pass.
The trochlear nerve nucleus is located in?
Pons.
No. In monofixation syndrome, microtropia is less than dash prism diopters.
Pass.
Normal diameter of lacrimal canalicularis?
8 mm.
No. Schneider's dystrophy involves which layer of cornea?
Stromal.
Correct. Creamy white discoloration of retinal blood vessels in some patients with hypertriglyceridemia is?
Hypemia retinalis.
Correct. So, 10 questions over. Fabry's disease is caused by deficiency of alpha galactosidase A. Cloverleaf defect pattern, patient fatigue, false negative. National White Cane Day is October 15. Corneal graft rejection line is Codados line. PRP first established in DRS study. Trochlear nerve is located in midbrain. Monofixation syndrome less than 5 prism diopters. Normal diameter of lacrimal canalicularis is 0.5 millimeters. Schneider's is stromal layer and lipemia retinalis. So 5 correct, 2 wrong and 3 unattempted. 40 marks. 40 marks for team C. Team 3 is team D. Shall we start? Invagination of optic vesicle begins by day.
Pass.
Homonymous hemianopia with usually sparing of macula seen in lesion of?
Occiput. PCA. Pass.
The rule used to, I think -5, you already told the answer. The rule used to create a prism in lens?
Pass.
Fundus picture of crack mud appearance is seen in?
Pass.
A person who is trained in dispensing ocular prosthesis is called?
Pass.
Wavelength of transpupillary thermotherapy laser?
Pass.
Yoke muscle for left inferior oblique?
Right superior rectus.
Correct. Barrow classification is used to classify?
Pass.
Time up. Okay. So you had 2 more questions. Invagination of optic vesicle begins by day 25. Homonymous hemianopia with visually sparing of macula seen in lesion of visual cortex. Prentice's rule is used to create a prism in lens. Crack mud appearance in progressive outer retinal necrosis. Person who's trained in dispensing ocular prosthesis is ocularist. Transpupillary thermotherapy laser wavelength 810 nanometer. Left inferior oblique York muscle is right superior rectus. Barrow classification is used to classify keratoco-cavernous fistula. You had 2 more questions. Vision in better eye with best correction less than 6/60 or peripheral field less than 20. At maximum distance, person is legally blind and Hollenhorst plaque is composed of cholesterol. So, 1 correct, 1 wrong and 8 unattempted. So, 5. 5 marks for team D. Team 4 is team B. Team B is team 4. Your time starts now. Dose of 5-fluorouracil used in trabeculectomy?
50 mg per ml.
Correct. The number of points used in testing?
54.
Correct. Long posterior ciliary artery is a branch of?
Pass.
When is World Sight Day?
October 30. October.
No. Most common cause of mucin deficiency?
Pass.
Most sensitive test for myasthenia gravis?
Pass.
Adduction and abduction occurs along which fixed axis?
Is the DAX.
Correct. Refractive index of silicone oil is?
1.4.
Correct. Cat scratch disease is caused by?
Bartonella-Hensel.
Correct. Syndrome associated with ipsilateral gaze palsy, ipsilateral INO, ipsilateral 7th nerve palsy is? Time up. Okay, so dose of 5-fluorouracil they told. The number of points in 24-2 is 54. Long posterior is a branch of ophthalmic artery. World Sight Day every second Thursday of October. Most common cause of mucin deficiency is vitamin A deficiency. Most sensitive test is IcePack test. Adduction and abduction in z-axis. Refractive index is silicone oil is 1.4. Cat scratch disease is caused by Bartonella-Hensel and it's 8.5 syndrome. 5 correct, 1 wrong and 4 unattempted. So 45 marks. Team A, are you ready?
Yes, ma'am.
Time starts now. What does MRD3 refer to?
Distance from pupillary reflex to the up gaze, extreme up gaze.
Okay. Gene associated with normal tension glaucoma?
Optinuria.
Correct. FDT perimetry primarily tests which type of ganglion cells?
M magnocellular cells.
Correct. Which gene mutation has the best prognosis for Leber's hereditary optic neuropathy?
Pass.
When is World Braille Day?
Pass.
The vitreous particles of asteroid hyalosis is composed of?
Calcium.
The condition where the patient sees targets moving towards them when the targets are moving perpendicular to the line of sight.
Facial duplicity.
No. Dorsalamide inhibits which type of carbonic anhydrase?
Type 2.
Correct. HLA type associated with birdshot
HLA
courier.
29.
Correct. Double ring sign of optic nerve head is a characteristic finding in?
Hypoplasia, optic nerve head hypoplasia.
Correct. So, MRD3 distance between upper lid and lower. You said from pupil, right? You said from pupil, so that's -5. Okay. Gene associated with normal tension is optineurin. FDT primarily tests magnocellular. Gene mutation which has the best prognosis is 14484. World Braille Day is January 4. Vitreous particles of asteroid hyalosis is composed of calcium. That condition is Pulfric's phenomenon. Dorsalamide inhibits type 2, HLA 29, and it is a double ring sign of optic nerve head is in optic nerve head hypoplasia. So 7 correct, 1 wrong, and 2 unattempted. So we have come to the end of all the rounds. Score is 65 for team A. So while we finally tabulate the scores, I have an audience question. All of them have undergone similar ocular surgery except Shah Rukh Khan, Mammootty, Amitabh Bachchan and Larry King. No. Correct, it is Shah Rukh Khan. Rest all have undergone cataract surgery. Now we have the final score. So we have the final scores ready. We have team D with 45 points, team E with 55 points, team C with 75, team A with 110, and the winners team B with 190 points. Congratulations to all of you, and I request Kochi Ophthalmic Club Secretary Dr. Thomas Arun Varghese to give away the prizes. Team C, third prize winners.
I am Dr. Lakshmi Bharavati, Junior Resident, second year from Government Medical College, Kottayam.
I am Dr. Aparna MK from Government Medical College, Kottayam, Junior Resident 2.
Congratulations. Second prize to team A.
I am Dr. Arya from Dr. SMCSA Karakoram.
I am Dr. Dimple from SMCSA Karakoram, Trivandrum.
Congratulations. Thank you, sir. I request Dr. Gauri Murthy ma'am to give away the prize for the first prize winners. Team B.
I am Dr. Ashmita from RIO Trivandrum, final year student.
I am Dr. Devi Karthika from RIO Trivandrum, final year.
Congratulations. Thank you, ma'am. Thus, we wind up KAAZCHA 2023. We also have consolation prizes for 4th and 5th place winners as well. I request Dr. Revati to give away the prizes. Team 4th place, Team E.
Myself Devi from Government Medical College, Kochi.
I'm Ashwati Vijayan, second year junior resident from Government Medical College, Kochi.
Congratulations. I request Dr. Binu Balan to give away the prize to Team D.
Hi, I'm Dr. Saidi Bavankule from Amrita Institute of Medical Science. I'm JR2 resident.
I'm Dr. Afreen, Amrita Institute of Medical Science, JR2.
Thank you, sir. So we wind up KAAZCHA 2023. Thank you, all of you. This was my first experience conducting a quiz. So I thank Dr. Litta for the opportunity. And I thank all my senior colleagues, Dr. Anabi, Dr. Binu, Dr. Sheena, Dr. Revati, for their constant support. And this would not have been possible for me without my 3 postgraduates, Sharon, Femita and Grishma. And thanks to Shihabuka for all the help with the PowerPoint. Thank you. We at Dr. Tony Fernandez Eye Hospital extend our heartfelt gratitude to each and every one of you, all faculties, delegates and postgraduates for your participation. Thank you and see you next time.